Good morning, my lovely people. Welcome back to our YouTube channel. And it's my hope you have woken up well from wherever you are in the country. Personally, I'm fine as you can see. And I thank God for the gift of this day. Because I know there are so many people who wanted to wake up today, but as we talk, they can't even talk nor breathe. So I always thank my Lord because each day is a blessing to my life. Let me start by appreciating you people for supporting this channel, for pushing me the far you have taken me. I don't take it for granted. For the returning subscribers, I always appreciate you because you hold a very big part of this channel. But I thank each and everyone who is doing anything, however little it is, to support this channel. And I know it's just a matter of time. It will be a great, big family. We have been talking about kidney failure for the better part of this month. It has been one of the longest topics we have ever had. It's an important topic, that's why I decided to discuss it bit by bit without rushing, because so many people had requested this topic and I never wanted to let you down. A day before yesterday, we started a topic about acute kidney failure. I gave you the difference between acute and chronic kidney failure, whereby we said that the only big difference between the two is that uh, chronic kidney failure occurs over time. Acute is sudden. And the other difference is that chronic kidney failure is irreversible, but acute kidney failure can be reversed when treated intensively and earlier enough. We started a subtopic about treatment for acute kidney failure, and we are still continuing talking about the treatment modalities that you can apply to such a person. And today we will start by looking at dialysis. Dialysis has been one of the best treatment modalities to people with kidney failure. Even in chronic kidney failure, we talked about dialysis. So you may need dialysis, but it's not always necessary. And it will likely only be temporary. So dialysis will be temporary. You may need dialysis, but it's not always necessary, and it will likely only be temporary. Dialysis involves diverting your blood out of your body into a machine that filters out the waste, then the blood is pumped back into your body. Dialysis involves diverting your blood out of your body into a machine that filters out waste. The clean blood then returns to your body. So your blood comes out of your body into a machine, it's cleaned, then when clean, it returns to your body. If your potassium levels are dangerously high, dialysis can save your life. This is very important, that if your potassium levels are dangerously high, dialysis can save your life. Remember here, your kidneys are not functioning. So the machine will assist in cleaning out wastes from your system. So if you have high potassium levels or hyperkalemia, dialysis can save your life because it will help in filtering out the potassium from your systems. Dialysis is necessary if there are changes in your mental status or if you stop urinating. Dialysis is necessary if there are changes in your mental status or if you develop or if you stop urinating. Sorry. If you stop urinating, definitely it will mean that your kidneys are not functioning, are not eliminating fluids from your system. And this will cause edema, whereby maybe the whole body will start swelling, or the hands, lower leg, and all that. So dialysis is necessary if there are changes in your mental status or you stop urinating. You may also need dialysis if you develop pericarditis or inflammation of the heart. You may also need dialysis if you develop pericarditis or inflammation of the heart. Dialysis can help eliminate nitrogen waste products from your body. Remember, this is a machine assisting you in remove. Yani, the machine is doing the functions of the kidneys. That's all we can say in a very direct version, that the machine will do the functions of your kidneys. And from this topic, I know each one of us can tell so many functions of the kidneys. So you may also need dialysis if you develop pericarditis or inflammation of the heart. Dialysis can help eliminate nitrogen waste products from your body. Let's look at the complications of acute kidney failure. Or what will happen if acute kidney failure is not managed earlier enough or in time? What will happen? Complications of acute kidney failure. One of the complications is that if acute kidney failure, which is sudden, is not managed, definitely it will develop into chronic kidney failure. So one of the complications is that you may develop chronic kidney failure. Number 2, heart damage. Number 3, nervous system damage. Number 4, end-stage renal failure. Number 5, high blood pressure. Let me repeat this again. Complications of acute kidney failure. Number 1, chronic kidney failure. Number 2, heart damage. Number 3, nervous system damage. Number 4, end-stage renal failure. And number 5, high blood pressure. I hope you get that. Let's get to the prevention of acute kidney failure. How will you prevent acute kidney failure? How? Preventing and treating illness that can lead to acute kidney failure is the best method for avoiding the disease. This is very important, that preventing and treating illness that can lead to acute kidney failure is the best method for avoiding the disease. In other words, you treat the predisposing factors or you manage the illness that is leading to acute kidney failure. That's why we have said preventing and treating illness that can lead to acute kidney failure is the best method of avoiding the disease. Remember we said that the aim is to slow down the kidney damage process. Even if you are not going to treat it completely, but you slow down the rate at which the kidneys are getting damaged. Having a healthy lifestyle that includes regular physical activity and a sensible diet can help prevent kidney failure. Very important. Having a healthy lifestyle that includes regular physical activity and a stable diet can help prevent kidney failure. So that means that with proper diet, which is balanced, and exercises, you're in a position to prevent kidney failure. Work with your doctor to manage existing medical conditions that could lead to acute kidney failure. This is very important. When you go to your doctor or your medical practitioner, make sure you explain yourself. Don't hide anything. Be open to your doctor. Tell him about the pre-existing conditions. Work with your doctor to manage existing medical conditions that could lead to acute kidney failure. So if you go to your doctor and fail to tell him the truth or her the truth, he or she will not be in a position to assist you. And definitely your kidney will be damaged. So don't assume anything in your body. Long-term outlook for acute kidney failure. Long-term outlook for acute kidney failure. Acute kidney failure can be life-threatening. That means it can kill. Acute kidney failure can be life-threatening. Chronic renal failure or end-stage renal disease can develop. In other words, the long-term outlook means the complications which will occur if this disease is not properly managed in time. So, acute kidney failure can be life-threatening. Chronic renal failure or end-stage renal disease can develop. Risk of death is high if kidney failure is caused by infection, trauma, or surgery. This is very important. Risk of death is high if kidney failure is caused by infection, trauma, or surgery. This marks the end of our video today. Thank you for your time. Thank you for the likes. Thank you for sharing. So let's continue supporting this channel and make it grow bigger and bigger. So if you are there and you are watching this channel for the first time, don't forget to subscribe and put the notification bell on so that whenever I upload a video like this, YouTube will automatically notify you and you'll never miss any of our content. Have a lovely day ahead.